Hey everybody, this is Dr. Jacob Plotz at Spinal Science in Jacksonville, Florida. Today I'll be demonstrating some nerve flossing techniques. So the principle behind nerve flossing is to get the nerve to move back and forth within its sheath. Whenever we have any kind of injuries that lead to immobilization or any kind of nerve impingement, sometimes it's caused by adhesions, aka rust, that builds up in between the nerve and its sheath. So the goal of these movements is just to gently move the nerve back and forth within its sheath to break up those adhesions, get the rust off it. So as we're going through these movements, there are many techniques for nerve flossing, so what I demonstrate is not the only way to do it. And while we're doing these techniques, the goal is just gentle movement. If something hurts, stop, you're probably taking it too far. And with nerve flossing, if you overdo it, you'll actually increase the inflammation and then it becomes counterintuitive. So the first nerve that we're going to be doing in the brachial plexus is the median nerve. Okay, now once again, main takeaway, every move should be nice, slow, and controlled. We're going to hold each position for 1 to 2 seconds. So the first one we're going to do is going to be a bilateral movement. We're going to be doing right and left at the same time. So position 1, you're going to be looking down, palms curled in, fingers curled down. Okay, 1, 2, then you're going to extend as you look up. Now you should feel a stretch going through the middle fingers. Focus on bringing the middle fingers down towards the floor. You should feel a sensation from the middle fingers through the wrist and sometimes into the forearm. 1, 2, and you're going to come back. Next one's unilateral. Now, the main reason to do unilateral versus bilateral is if the bilateral is too aggressive, okay? Some people find that the unilateral is a little bit more gentle. So if it's too much, always go back, okay? So this next one, you're first going to begin by pushing your shoulder down. Palm's going to be out, okay? Position 1, you're going to bring your head towards your arm as your wrist flex backwards. Now once again, you should feel the pull going through the middle finger, through the palm of the hand, and sometimes into the forearm. 1, 2, you're going to go back the other way as you change position in the wrist. Okay, and then repeat as specified during the introduction. So the next nerve in the sequence is going to be the radial nerve. Once again, I'm going to show it bilaterally, and then I'll show it unilaterally. So position 1 for this one, once again, starts with pushing your shoulders down. So you're going to rotate your hands in, focus on pushing your index and your thumb down to the floor. It's going to be 1, 2, then you're going to look up as you gently reach back. You should feel the stretch going through your index fingers and a little bit into the thumb. Sometimes it'll make it all the way up into your forearm. 1, 2, and then back. Now the unilateral one, you're going to once again push the shoulder down, hold your hand backwards like you're a waiter asking for a tip under the table. You're going to tilt your head towards as you go back slightly. 1, 2, and then come back to neutral as you shift position forward. 1, 2. All right, so the final nerve in the brachial plexus that we're going to focus on today is the ulnar nerve. Once again, I'll show it bilaterally and then we'll do it unilaterally. So the first move is to make the OK sign, palms down, arms at 90, but you're going to try to keep the shoulders down as you do this. You're going to stretch out through the pinkies. So if you radially deviate, aka come forward a little bit, that's perfectly fine. You should feel a light stretch going through the pinkies. So this is position 1, 1, 2, and then without rotating, we're going to bend the elbows and bring them up. Now the pull will get stronger, so just take it to where you can handle it, and then hold that position, 1, 2, and then come back down. Okay, and then unilaterally, once again, we're going to start by pushing the shoulder down. You're going to bend your arm at 90. Okay, position 1, you're going to tilt your head toward as you bend your hand toward. 1, 2, position 2, you're going to go the opposite way. 1, 2. All right guys, well that concludes the nerves that we're going to be going over in today's video. If you liked our content and appreciate the free information, please like and subscribe to our channel or follow us on social media. All the links will be in the description. Now remember, when beginning any kind of regimen that involves your nerves or your health, consult with your healthcare provider before proceeding. Thank you. You all have a wonderful day.